Good afternoon. Thank you all for joining us. I'm Bill O'Malley. I'm a Strategic Account Executive here at PS&I. I'll be moderating and monitoring your questions today while my fellow AE, Christine Drucker, presents the second in our professional development series, The Case for a Nursing EHR versus a SIS, or Student Information System. If you're already a customer, you probably already know our speaker today. Christine Drucker is an MBA who's been working with and to support school nurses for many years. With that, I'm going to turn it over to Christine.
Thank you so much, Bill. Hi, everyone, and thank you for taking the time to join us today. I've been working at PS&I for almost 13 years, and previously I worked in a healthcare setting where I advocated for nurses in various roles. I work side by side with nurses every day, and every day I speak with nurses like you, and I've come to respect and admire your compassion, drive, and strength. Every day I hear about your challenges and obstacles. The topic I'll be reviewing today is something I'm passionate about, and that's sharing talking points with nurses so they feel empowered. During this webinar, you will identify the major differences between a student information system known as a SIS and a true electronic health record, an EHR. At the same time, I will be reviewing what you will need to look for in an EHR. For those of you currently using an EHR, there may come a time where you're asked to move to a health module in your district SIS. Some of you today may have already experienced this. Having the key talking points at the ready can help you prevent the conversation from turning into a challenge. If you're using the health module in a SIS, this information can provide you the talking points you need to develop a case for switching to a true EHR. And today I'll be reviewing those talking points. And I'm just going to start by defining each software program. A student information system, or SIS, is also known as a student management system or school administration system. There are hundreds of different SIS software programs used across the world. In the field of education, SIS are used to manage student data. SIS capabilities range from student registration, grading, transcripts, storing student results, and other assessment scores, creating student schedules, tracking attendance, and managing many other student-related data needs in a school. A SIS is developed by programmers, and it's usually designed as a one-size-fits-all software program for educators. That means almost all district staff use the same software to support their role, whether it's principals, teachers, librarians, cafeteria staff, or secretaries. Again, it's designed for grading, schedules, registration, etc. Most SIS offer some type of health module, and administrators are led to believe that this health module fits the needs of the school nurse. They also tend to believe that this functionality is low cost or free. It meets the needs of the school nurse and allows the nursing staff to use the same software program as the rest of the educational staff. With budgets tighter than ever, sometimes the pressure to use the health module in the SIS becomes hard to dispute. That's why we'll be reviewing these talking points today. Should you face this pressure, you'll be prepared. So let's review the fundamentals of a true school-based EHR, which is designed very differently. The primary focus of an EHR is not education, but rather the documentation, tracking, and reporting of student medical and health data. An EHR is 100% confidential and meets FERPA and HIPAA compliance. Beyond documenting sick visits and identifying students with health alerts, EHRs include functionality such as case management, individualized healthcare plans, and emergency action plans, screening templates and referral letters, the ability to efficiently document administered medications and treatments, as well as immunizations. Some SIS can offer these features, but do their features truly meet the needs of a busy school nurse? Here's a few questions you might want to ask your vendor. Can the SIS report on health so that you can identify health trends and make data-driven decisions? Does the SIS software follow a nurse-driven workflow that allows you to follow your nursing standards of care and provide district-wide protocols? Can your SIS monitor so that you can analyze the health of the population within a classroom, grade, school, or across the entire district? Can your SIS quickly identify students at risk so that you can support keeping kids in the class so they can learn? Can the SIS share critical health information with those that need it when they need it, while maintaining FERPA and HIPAA compliance? Chances are the answer is no to all of the above. So why is a true school-based EHR so important? The first challenge is that in the medical field, nurses have stringent documentation requirements to protect their license, mitigate liabilities, and documentation is a critical piece of providing quality care. Secondly, some of the central challenges schools face with cannot be adequately handled with a SIS. These include state requirements for health services reports, which can also be linked to funding. The free care policy that is opening states to allow billing on all Medicaid eligible students. Districts are always looking to identify at-risk students and improve absenteeism rates. Schools are vulnerable to liabilities, whether it's an injury or health-related emergency. Administration of controlled substances and expensive medications also poses additional risks. And cybersecurity and privacy are always at the forefront with online applications. A true EHR provides a solution to meet the complex documentation requirements of a school nurse, offers hundreds of health reports that can be easily run on demand. Billable time from Medicaid can be efficiently captured at time of service. Students at risk can be identified with health trends. Risk management features and health surveillance protects the district from liabilities. Medication inventories and audit trails provide safeguards, and an EHR is FERPA and HIPAA compliant. Your data is secure and protected. So I'm going to now explore a little bit more of these talking points in more detail. As I mentioned, a SIS is developed by programmers. Programmers with no medical background or real-world healthcare experience. Their world is education, not health or nursing documentation. Yes, I will admit a little bias here. I believe a true school-based EHR company will employ full-time RNs and experienced school nurses that are involved in software development and design, so that the engineers have insight into the workflow processes of a school nurse. These staff RNs provide guidance, making sure the software makes sense to the nurse. A true school-based EHR software company should have full-time nurses on the development team to make sure that the voice of the nurse is heard. And how about technical support? When you have a nurse-specific documentation question, can you call your SIS and get the assistance you need? Perhaps you have a complex immunization requirement. Can you call your SIS vendor with a vaccine question? Unlikely. On the other hand, the EHR vendor provides you the ability to speak with an RN like yourself that understands your industry terms, acronyms, and documentation requirements. Another differentiator between a SIS and an EHR is user-friendliness. But what exactly does that mean? How is software user-friendly and why is it important? Well, if the software is designed based on the knowledge of the health clinic workflow process, and if there's a real understanding of the amount of multitasking and triaging that takes place day to day, then the software works with the nurse. SIS programmers don't have this insight and develop the software based on what makes most logical sense to them, which results in a health module that is cumbersome and time-consuming. And taking time out of an already filled day is something nurses cannot afford to lose. Again, the SIS world is education-focused, not nurse-focused. Security is another subject nurses voice real concern because software that has been designed for educators does not offer the same level of security as a true EHR. An EHR maintains full FERPA and HIPAA compliance, ensuring that data remains secure and protected at all times. Access to data within an EHR is controlled by customized logins, specialized PINs, a user access log, and behind-the-scene audit trails. Audit trails track content a user has viewed, modified, added, and/or deleted. The audit should include the date and time of the edit, what was edited, and the username who made the edit. Without audit trails, electronic records will not hold up in court. Questions you may want to ask your SIS vendor. Does the SIS provide audit trails or a user access log? Can I prevent other faculty from accessing health information? Is there log overwrite protection? If the answer is no to any of these questions, your health data may be at risk. We briefly covered compliance. Now, what about data protection and what does that mean? A nurse always needs to have access to all health data, current and historical. So how do software providers ensure health data is always accessible? It's accomplished through secure, reliable, and high availability data centers. EHR software companies that host use multiple servers and redundant technology so that if there's a failure in one area, a backup is immediately available. This ensures no unplanned downtime. In addition, they create backups and redundant off-site backups as part of disaster recovery. A reliable EHR vendor will undergo audits such as SSA 16, a year-long assessment where not only are the servers audited, but also the company's business practices, policies, and procedures. SIS are not subject to the same security measures as an EHR. They focus on grades, registration, and other non-health related data. An EHR focuses on health, which requires the utmost protection from data loss or breach. I just reviewed the differences between a SIS designed by programmers versus an EHR designed by nurses. I hope you recognize the importance of having nurse involvement in software development and technical support, and the influence it has on time management, workflow process, and user friendliness. We also reviewed the differences when it comes to compliance, confidentiality, security, and data protection. Now let's review some real-life application and how they differ between a SIS and an EHR. Nurses are in a unique position to identify students at risk. At-risk students may visit the nurse more often for a variety of reasons. Because the nurse can see up to 60 students in a day, and subsequently the day is full of multitasking and triaging, a student at risk may be overlooked. One of the most common concerns I hear from nurses is that their SIS cannot support identifying health trends and therefore cannot detect potential at-risk students. Something as simple as seeing how many times a student has visited your office in just a glance or running a visit frequency report, they're just not available in a SIS. And in EHR, this valuable data is collected behind the scenes, and nurses are using the results to identify trends in students at risk. For example, recognizing trends in recurrent visits and frequent time of day might prompt you to investigate if a student might be skipping class, avoiding bullying, missing meals, or struggling with home issues or a chronic health condition. Moreover, you can determine the amount of class time lost. Identifying students at risk enables you to support the overall goal of keeping kids in class so they can learn. Another key question: how is your SIS supporting you during a health crisis? When we're just about 10 months into this pandemic, how long do schools have to wait for upcoming releases to support nurses on the front line? SIS companies have been focused on the education side of this pandemic, modifying learning management, staggered scheduling, job boards, and virtual learning components of their software, not the health monitoring and coordination of students and staff. On the other hand, EHR companies that are dedicated to nurse-focused software are able to deliver new functionality quickly. Moreover, some of the most advanced EHRs, with their laser focus on the practice of school nursing, already built in health surveillance functionality to track and report on outbreaks and cluster cases such as flu-like symptoms and H1N1. This meant that last spring, when a pivot to remote learning happened so unexpectedly, school nurses already had the key elements in their software to support their districts and their students during a pandemic. This set the stage for COVID-19 specific functionality to be put into development immediately without the lag time of having to develop from scratch. At a time when the educational world was turned upside down, the district health staff had access to new COVID functionality and technical training prior to returning to school that fall. Early detection and real-time notifications from an EHR support school nurses and district administrators to act quickly to reduce or eliminate potential health hazards. Now more than ever before, schools need an EHR with these type of capabilities. Communication with parents is another essential responsibility of the school nurse. How is your SIS supporting your communication efforts? Almost all SIS include parent and staff portals for registration and grading. Some SIS portals are even able to capture some limited health information during enrollment, but they cannot capture all the health information nurses need, nor can they provide the ability to capture electronic signatures or collect health forms, which means the nurse has to take time out of the day to chase parents. A school-based EHR health portal connects nurses directly with parents. Through a secure portal, parents can update health information and electronically sign and submit forms. In a nurse-controlled environment, health information can also be shared with parents in real time, which is ideal for students with health conditions. As I mentioned previously, the EHRs that have the most value to schools are nurse-focused organizations who have the expertise to quickly add meaningful features during times of crisis, such as COVID-19. The EHR health portals that provides COVID screening forms where parents and staff can complete the screenings from home, or complete on-site offer a substantial advantage by having all medical and health data stored in a single, secure platform. What about immunization compliancy? Your SIS may allow you to enter vaccine data. You might even be lucky enough if it can calculate compliancy. However, SIS do not have the capability of truly providing accurate compliance. Reason being is that SIS do not have the expertise or a dedicated nursing informatics team to decipher complex immunization rules for each state. A true school-based EHR will provide accurate compliance by recognizing combination vaccines and live vaccines, exemptions, as well as offer conditional enrollment. One example of how important it is to have this data at your fingertips is whooping cough. If there's a case in your district, would you be able to identify students without a pertussis vaccine with your SIS? Calculating and communicating noncompliance can be a great burden with a SIS. In contrast, this can be accomplished with an EHR in seconds, not hours or days. Vaccine data entry is another burden for school nurses already busy with student encounters and everyday activities. EHR software that connects to any state registry that can and is willing to share vaccine data will also save a significant amount of time. Medicaid is another undertaking becoming more prevalent in schools, especially with the free care policy that is opening states to allow billing on all Medicaid eligible students. If you are not billing Medicaid now, you may need to in the future. If you're fortunate, you may be able to use your SIS to bill, but that is a rare commodity with SIS. And chances are the functionality will be even more cumbersome and time-consuming. Most nurses that use a SIS and bill for Medicaid are having to use two systems. That's right, it means double documentation. Understanding that your plate is already full, you need an EHR that reduces or eliminates time spent billing so that you can stay focused on providing health care. An EHR developed by nurses offers quick and efficient documentation and capture of billable time at time of service. We're running low on time, so I'm going to step it up a little bit. Risk management is another topic of concern, and a proactive approach to mitigating risks in schools is a necessity. From behind the scenes, an EHR monitors student activities for matches against district-defined risk sets, such as an injury that occurs on school grounds. When an EHR detects an occurrence, this vital information is communicated to all members of the district's risk management team. Communication needs to be secure and meet HIPAA requirements containing no personally identifiable information, PII. This type of feature protects the nurse and district from liabilities. Nurse leaders are also using this EHR feature to receive notifications of emergency situations such as ambulance transport, AED or emergency medication use. It enables them to be proactive and supportive in critical situations. Again, SIS systems are focused on grades, not health, and lack these attributes and the confidentiality that an EHR delivers. This is the last but not least of the talking points. Medication accountability. Administration of controlled substances and expensive medication poses accountability and exposes liability. Almost all SIS provide a medication module. However, the needed safeguards to protect you and your district from liabilities are not present. A true EHR provides medication inventories and audit trails so that you can accurately document and electronically validate medication changes and their counts. In addition, an EHR should include one-click access to a drug database that provides all vital information on each medication and the manufacturer's pictures so you can verify that you have the correct medication in hand. With a true EHR, nurses can confidently and safely administer medications. So in summary, a true school-based EHR company understands that there is no other health professional that care for so many under one roof by themselves. And what is even more challenging is all of the activity needs to be documented. Unlike the health module in a SIS designed by programmers and EHR designed by nurses makes the software very user-friendly so that nurses can document and track all of the activity that takes place during a typical day. Different from a SIS used for grading teachers and principals, the EHR is focused on health documentation. Right now, SIS systems are laser-focused on adapting learning to a virtual environment, not the health monitoring and coordination of students and staff. Nurses need a comprehensive EHR designed to not only manage student health records, but coordinate healthcare, provide in-depth insight to the overall health of your student population, and most importantly, right now, manage community health during a global health crisis. So I realize that working in professional isolation has a host of challenges, and sometimes we just need to educate the educators. So today, I just hope that this presentation has left you feeling empowered. And with that, and I'm going to check with Bill to see if we have any questions.
Thanks, Christine. Yeah, we've got a lot of good ones here. Let me try and hit as many of them as I can in the next 3 minutes. So I have a couple of different people asking some variation of this. I know that I'm not using all of the features you described today, like health surveillance. Is there a training? Can I get more information?
One of the most valuable resources that is, I think, very underutilized by our customers is our customer portal. At the customer portal, which you can find right via our website, you can access video trainings, downloadable how-tos, and there are specific trainings for health surveillance. And also, once, we had developed or enhanced features to handle COVID-19, we also provided training for our nurses. So any nurses using our software are able to access this information. There's, I think, at least 4, 5 or more different trainings on documenting COVID-related encounters. And of course, anybody who's familiar with our tech support knows that we have a great tech support team to turn to as well.
Excellent. Here's one. Where can I get more information about the updated COVID functionality?
That would be the same place. So right at the customer portal, in fact, I'll pull it up on my screen. Just bear with me. Right here at the customer portal, if you go click on support and then you just even type in COVID, you'll be able to see all of the resources and trainings available to you. So those are all right there.
Excellent. Okay, here's one. The email invite mentioned a white paper. Will you be sharing this?
That will be sent out, I believe it's via email next week. So anyone who's attended today, we should be sending that out via email. And of course, don't hesitate to reach out to us to request it as well.
Excellent. And quickly, we have about a minute left. My district is not billing yet, but where can I get more information about Medicaid billing?
The same place, the customer portal. And also, just last week, I think it's here, we provided, or one of our experts here provided a presentation, a professional development presentation, and it really focused in on the basics. So if you're not currently billing for Medicaid, That's a really good place to start. You should be able to find it at our customer portal under professional development webinars. And that's a good place to start, but we also have specific Medicaid billing videos and how-tos at the customer portal as well.
Excellent. Well, that said, we're out of time. I have more questions, but we will send email responses to all very shortly.